pain and temperature, pain and temperature tend to cross over at the point they come in. So your sensation of hot and cold, that sort of thing, that tends, if it's coming up your leg, it goes up into your lumbar cord. Okay, it tends to cross over immediately and then go up to the left side of the brain. Okay, most of your other sensory perceptions like balance and fine touch and vibration and things like that, they tend to go up, cross over in the medulla, and then go up. Okay, so, but we'll talk a little bit about that when we get to the cord. Okay, so, this is a coronal section. Now we're slicing it from top to bottom. Here's that internal capsule again. You can see the fibers heading down toward the brainstem. Here's the ventricles. Here's the septum pellucidum. There's the fornix. The thalamus is on either side of the third ventricle here. Okay. It looks like we've got part of the optic tract that's being cut here. Okay. Here's the caudate. Here's the putamen. The globus pallidus down in here. Okay. So, and again, here's the insula. Okay. This area, this whole area. And I've got one that's labeled for you to show you those similar pathways. Okay. I put up a slide just because the syllabus says you need to know the circulation of the cerebrospinal fluid. So we've already talked about it a little bit, but let's go over it again real quick. The choroid plexus here, these are the structures that are making the fluid. These are the ependymal glial cells. Okay. It's going to flow out of the ventricle into the third ventricle, okay, down the cerebral aqueduct into the fourth ventricle, and then it's going to go out either two holes, the foramen Magendie or the foramen Luschka. Luschka is lateral, Magendie is medial. Then it's going to flow around in this space. It has to flow up and around the tentorium cerebelli here, the dura that's forming the roof here, and then it'll flow around in the subarachnoid space, all around the brain, all around the pituitary. It actually flows around the optic nerve as well, because your eyes are really part of your brain. The eyes bud out of brain tissue as they develop, and then they become eyes. So they're actually covered with dura. Okay? The white tough part of your eye is the same type of material that surrounds the brain. Okay? So, and it can go around the cord, come back up, and that sort of thing. So that's the path of the basic fluids. So now what happens if you have blockages here? Okay? You can be born with blockages there. You can develop tumors that block that cerebral aqueduct. You're producing a lot of fluid. You're going to get high CSF pressure in the brain. Okay? As an adult, you're going to have all kinds of issues that need to be addressed, right? And one of them might be this. As a matter of fact, this might be the way the tumor is found. Okay? If you have a blockage and you get, or if the cerebrospinal fluid gets pressurized for any reason, if your brain is swelling from a tumor, you're going to increase the pressure of this fluid. It's going to work its way up the optic nerve and put pressure on the back of the eye. This is normal. This is what the optic nerve looks like as it leaves the eye. You're looking in the eye with the scope. Okay? You can see the blood vessels that come in with the nerve, but this is where your blind spot is in your eye. And these axons are diving out, going toward the brain right here. The optic disc is what it's called. But when you put pressure on the back of it, it blows up like this. It gets swollen, edematous. They call it papilledema. Any doctor that's checking you out for headaches and things like that, you better look, okay? Because you want to be sure that one of the reasons is not increased cerebrospinal fluid pressure, okay? And you can see this on the scope. Found a couple of them. Not terribly common, but certainly in 20 years I saw maybe 4 or 5. But you don't want to miss it, okay?
Can that also be caused by the pituitary?
Papilledema?
Yeah, just the swelling.
No, well, it would have to be a huge pituitary tumor.
Okay.
Yeah, but it's going to cause visual problems for other reasons.
Okay.
Because the reason the pituitary causes visual problems is because the optic nerve is crossing right on top of the pituitary. So as it grows, it doesn't have to grow very much, and you start stretching the optic chiasm. Okay, so you're going to get visual problems. Okay, but this is actual CSF pressure pushing on the back of the eye, giving you this real weird look. Okay. Now, what would happen though if we blocked it here? Then we start building pressure up in the ventricles, and you get things like this. Okay. Look at all that fluid in that ventricle. That's huge. That's huge. Okay. It's
Is that what they
squeezing.
call the water?
Hydrocephalus, water head. Right, water brain, basically.
When I was a baby, they had to take fluid off, take drain fluid out from my spine and my head, because I went to sleep and I wouldn't wake up.
Was there any particular diagnosis later?
I don't know, they were telling my mom, so. I could have died from it, I guess, I don't know.
They probably just did it for you.
Like I went to sleep and I wouldn't wake up.
You
It was
look like you
2
need some
days.
fluid drain.
They said it was like fluid on my spine.
You might have had a little cyst or something. Is there any incision or anything there?
Oh, I don't know.
Okay.
It was like when I was like 18 months.
Interesting. But you can have all sorts of little cysts at the base of the skull where the spinal cord just goes in, and sometimes you do have to go in and take out those little fluid-filled cysts. It's all part of just an abnormality of the development of the spine.
Can that be fixed?
No, not really. Well, it can be treated, but once it gets like this, it can't be fixed. You're not going to shrink the size of the head. Okay. What they do now, you rarely see this in the modern world because they'll go in when they first diagnose it. That's why pediatricians are always measuring the baby's heads. If they don't suspect it for some other reason, like behavioral issues or like lethargy or something that they think what's wrong with this kid, but they're still checking the head inside and they want to see the head growing on the normal curve. Okay, anything unusual, they're going to get scans and take a look, but they'll treat it by putting it's basically a catheter, a shunt from the cavity, and they'll take it down into the abdomen and it'll just drain the fluid in the abdomen. Okay, so it takes the pressure off the brain.
And then they'll live like that?
Yeah, you got to, if that cerebral aqueduct is blocked, or if it didn't develop, maybe there's some
So
new
that's a
surgery that will
permanent,
bring it back up, but I'm
permanent
not aware of
fix? It's a permanent thing where they drain it and make it,
Yeah.
so they do it internally and
it.
it's
Yeah. Sometimes they have to
identical.
have it replaced and.
As they grow,
Yeah.
right? As they grow.
Right, you're gonna get bigger.
Is
Yeah.
there brain damage associated with that?
Not if you treat.
Not if we get it from the
But that's a good question. I'm not sure the percentage of kids that have normal mentation with this. I'm not sure. But many of them are handicapped. Yeah.
So you said this happens when you block any ventricle
Well, you block the outlet.
outlet?
Yeah. If you go back and look, we could block it here, and we're blocking both ventricles. Okay? We could block it up here, and we might only be blocking one, because you got one on each side, and they have a drain that goes sideways. Okay? So I guess you could block one ventricle and have a one-sided issue. Okay? I just thought I'd show you a couple little pictures, all PBS things. Here's a brain tumor. Okay. I'm not an expert, but in my estimation, this was probably fairly slow growing because you don't see a lot of swelling around it, and obviously, this was fatal, I'm sure. Okay.
How is this one sliced?
This is a coronal, top to bottom.
Okay.
This is a hypertensive lacunar infarct, remember? This is the pons. This is where all those fibers are running through from the top part of the brain, and the motor and sensory stuff is all packed in there. So anytime you knock out a section, you're going to get some fair deficits. Why do you think they call this a lacunar infarct?
The lacuna
Sorry?
is part of the bone.
Because it looks like a hole. Yeah, a lacuna is a hole. Yeah. The tissue dies, it's all reabsorbed by the little glial cells, and so you just basically have an empty hole there.
From high blood pressure.
And that's where blood flows, blood's cut from.
Yeah. Infarct, you cut off the blood supply, the tissue dies. So it was a small arteriole that got blocked, and you killed out a portion like this. You kill out a bigger portion, that's when you just decapitate the person. If they live through that, that's when you get locked-in syndrome.
So something that small, you can live through?
Oh, yeah.
What kind of damage is done in that area?
It depends on what fibers are running right through the hole, okay? That's why I say you can get almost any deficit depending on where the hole is,
Right.
okay? Here's a cerebral infarct. Part of the brain is dying and almost liquefying out here, okay? This, yep,
No, I was just pointing. It looks kind of funky up on it, like
yeah,
1
up
o'clock
here.
too.
Yeah, you can get multiple infarcts.
Okay.
Multiple infarcts. Multi-infarct dementia is a thing you might see occasionally, where people have slow strokes, little tiny strokes that just pepper the brain
Yeah.
until they finally just, are having cognitive difficulties. They may not even know that maybe one hand is a little weaker than the other. They may not even appreciate that until you test them. Okay? So, here's a bleed, obviously fatal. Arteriovenous malformation, or AVM. You can see what looks like the clot right here inside the AVM. These are usually congenital abnormalities where you have arteries and veins that grow together into a big clump like this. So you're getting blood that can be shunning back and forth between the artery and the vein, and sometimes it'll just blow up like a balloon and just rupture. Okay? And it ruptures. Okay? So you're getting bleeding inside the ventricles.
So would that be an adult brain? That's
Yeah, that looks like an adult brain. But one of the big surgeons here in town lives right over here on Lake Elbert. I'm blanking on his name. General surgeon. When I first started practice a few years ago, he had one of these during surgery, okay, and he never practiced again. So, but he lived, but he had stroke-like symptoms. Okay, we'll cover this later.